we don't take more than 60 minutes of your precious time. I know that we are all pressed with meetings and many things to do, but thank you very much for being here and for being so many. I can see that there are many people connected from many different parts, many countries, and I'm very pleased that this webinar series is having a very great success. We are continue receiving very positive feedback from all of you, and we are very pleased about that. As you know, this is a webinar which is organized by the Regions for Health Network in collaboration with the Venice office, where we are now, and with the Bonn office of WHO, which is the European Center for Environment and Health. And we started this series of webinars as a result of a workshop that we did at the UFA conference last year in Stockholm, where we understood that it was necessary to provide you at least with more information about some of the tools for environment and health which can be used at the subnational level. And that's why we had already 3 webinars. One was on heat, one was on RQ+ for air pollution. Today we will speak about climate change with a very interesting presentation, and next month we will speak about and blue spaces in November. Sorry. And we will end our series in December with a webinar on health impact assessment. Climate change is, of course, a very important topic, and we all hear about this many times every day, I guess. Many of you are participating from the small countries and the small countries initiative, and you might recall that last June in Iceland, the small countries endorsed an important statement on water resilient communities and system and climate change. It is precisely about this that we are going to speak today. Also, we had a very hot summer, I guess, in many countries in Europe, and maybe Vladimir will be able to explain something about that also. You received from me a picture as a reminder of this webinar, which is the one that we have here in front of us now. I don't know whether you actually were able to solve the kind of rebus here, or maybe about what this picture means. We wanted to have a thought-provoking picture at the beginning of this webinar, and this is what I was sent by Vladimir, who will use this picture to say many things about climate change. So we are all very eager to know what this picture actually means. And with that, I would like to pass the word now to Vladimir Kendrovski, who is technical officer and really a top expert in the field of climate change. And we are really delighted to have him here with us. He works in Bonn at the WHO European Center for Environment and Health. And before giving him the floor, I would like just to say a couple of things, like housekeeping things. Please, for questions and answers, which will be in the last 20 minutes of this hour together, write your question through the chat, which will be visible to everyone, and I will channel the questions through Vladimir later on. This webinar will be recorded, as all other webinars also before, and it will be posted on the RHN YouTube channel. And also, for the sake of background noise, we are muting everyone by default, and that's why I'm asking you to channel all questions through the chat. Vladimir, I can see that you are there. Probably when you start speaking also, you will appear full screen. And I know that you have prepared for us a very interesting presentation. First, you will speak about climate change and health in general, and after that you will go more into the details of the economic tools. very interesting. We are all here to listen and to learn from you. So the floor is yours.
Good morning. Thank you, everybody. I'm very pleased that this morning I have opportunity to address you, and thanks to for your presence. And yes, the photo I share with Francesco and with you is just to make some important clarification before anything else about the weather, about the climate variability or climate change. Because let's first discuss the difference between the weather, which in fact refers to the atmospheric condition expected in the particular location in the same day or hours, and climate, which is typically refers to average of such atmospheric condition in long term over years or decades, at least around 30 years. So we will see. So climate is something which is connected to some bigger area that weather which affect the specific location. And then we have the climate variability, which means some fluctuation on seasonal or multi-seasonal time scale, and it's referred to the is describing the nature fluctuation. For example, all of you heard about El Nino. We have in the western part the North Atlantic, which is located in South America. But we have here in North Atlantic oscillation in the area between Iceland and Azores, and they fluctuated. They changed the summers, in fact. So this weather variability or this climate variability of this hot summer was due to this climate variability. And then to the end, we come to the climate change, which is alteration of the Earth atmosphere, the global one that occur over a much longer period. It can be decades and millennia. And the climate change is caused, of course, by the natural process, but here we include and we're referring to the change attributable to human activities when talking about climate change, such as increased greenhouse gas emission due to since industrial revolution up to now, which create a change of the natural environment. So this is for the beginning. I'm pleased to use also opportunity
Vladimir,
to share. Yes?
Sorry, just 1 second, because there is a kind of a background noise, like a keyboard typing. We are asking Andrea now to check and whether it's possible to eliminate also this background noise.
Okay, I'm not.
Well, you're not the one typing for
not
sure.
the one.
Okay, thank you very much. Sorry for the interruption.
You will tell me when I to continue, or?
Yeah, please continue.
Okay.
And Andrea is trying to check, and also please make sure that you are muted, and also that if you have your microphone close to the keyboard, please put it in a different position so that we don't hear you typing. Thank you very much.
Okay. So I also will use opportunity just to remind probably each of our colleagues use this opportunity that multiple diseases can be prevented through a healthy environment, because in fact there are many compelling reasons why we need to clean up our global environment, and one most pressing is it is a polluted environment, and it's deadly one. In Europe, 1.4 million deaths occur annually in the WHO European region, or 1/5 of all deaths is due to the risk factors like air pollution, bad water management, chemicals, radiation, and climate change. And the vast majority due to cardiovascular diseases. I will repeat this slide we prepared for the Iceland meeting, where you can see the standardized that attributable to the environment. For the small country initiative member states, where you can see in red the quantity that non-communicable diseases and majority of cardiovascular diseases is due to these environment problems. Let's back to our story. Yes, we have heat waves in Northern Europe in summer 2018. We have last Euro-Mediterranean heat in 2017, probably. You remember the Lucifer in South Europe. So daily we are aware that the weather is affected our health, and it's because it's become hotter. It affects our daily activities, and it can be additional risk to our daily life. So that's why we start to take in consideration more in recent years the differences and in the weather variability, the climate variability, and how they affect our health, because we have more and more evidence on this. This is some of the climate change in recent years have established new record levels, such as the global and the European temperature. So you can see that since 1850, the global temperature increased for 1.2 degrees Celsius compared with 2007 and with the pre-industrial level base. And you see that since 50s, each of the decades is hotter than the previous one. And in particular, the last 30 years is very dramatic. So this is the climate change, and this is something which is connected with the elevated emission of carbon dioxide and other greenhouse gases due to climate activities. So here is very complex figure.
Sorry, Vladimir. This is Andrea from Venice.
Yes.
Could you share your presentation?
Yes, I'm sharing one. Do you see the presentation? Yes. Sorry, Andrea?
Not actually. Could you share it?
I think that sorry, I'm a little. My screen is on this. Should be.
Okay, now it's better.
It's better?
Yeah, now we see your Word file.
Now it's better, but is it fine now?
Okay, now
it's fine.
Now it's okay.
Okay. So we see in this complex slide that climate and weather affects our health and well-being in many ways, through both direct physical impacts and flow on social and economic changes. Of course, climate change is affecting health now and will continue to do. So this includes the extreme weather events, changing infectious diseases, distribution and patterns on non-communicable diseases. And climate change will continue for many decades to come, having further impacts on ecosystem and society. And so it will affect almost everybody, but vulnerability to weather and climate change depends on people levels of exposure, and exposure of health hazard related to climate change will affect differently some communities in different countries to different degrees, different ways. So this is one of the map with potential climate change effects on some region in Europe. So each of you can read. I can use probably the one on Southern Europe and Mediterranean, where you can see that it's more sensitive to hot weather and heat wave exposure, increased heat wave mortality and morbidity due to climate change, foodborne diseases, dryness, desertification will increase, reduction in food production, increase in forest fires. We were witness of what happened in Greece this summer, and so on and so on. This is the drivers. This is you see how the weather and climate will affect the health outcomes. So on the temperature extremes, on the weather extremes, drought, water quality, air quality, and this is the health potential outcomes, and of course increase or decrease in some due to evidence. This is the table we did for our partners in European Environmental Agency. You see here, for example, the number of people killed per million due to 4 types of natural hazard: floods, cold, heat, and storm. You see that the heat waves were the deadliest extreme weather event in period 1991-2015 in the region, caused tens of thousands of premature deaths. And of course, others were affected. The mortality burden due to direct effects of heat in most of our member states was estimated, but it is a problem that the records for extreme weather events are being broken and of number of times, and the global temperature records were broken also in the last several years in a row. But the problem is that the length, frequency, and intensity of heat waves will increase in the future, and there is no good news. So this will think of the most, the very, with the very high confidence that this will happen in the future. And the mortality burden due to the direct effect of heat, in our member states was estimating using different scenario by country, and citizens from Mediterranean and Central Eastern European countries will be most affected by heat due to higher estimate attribution in the coming years. So this is all of this evidence are available. So we are aware that the heavy daily participation in Europe has increased substantially in the last 60 years, and further increase in heavy daily participation are projected, in particular in winter. This is the number of very severe floods in Europe, which has increased in recent decades. And by the way, the floods killed more than 2,000 people and affected approximately 10 million in the period 1991-2015 in our member states. So I use this example from the Ramses EU project, where we participate as a partner, to just highlight how it's important some of the priority areas for climate change, impact assessment due to agglomeration of the people, how it's important to and it makes the cities particularly vulnerable, because climate change has a direct impact on cities, including increasing health problems due to heat or floods, because of the damage of the building and infrastructure, and because of vulnerability, because with a higher proportion of elderly people, cities are and will be more sensitive to heat waves and other climatic hazards. In most European cities, there is still limited awareness about the adaptation policy design and target of vulnerable groups, and about the need for assessment. So that's why it's important to discuss with the policymakers and to discuss with the policy decision makers about the health arguments we use. Because without involving the vulnerable groups of adaptation solution, implementation can be can increase the inequalities, in fact, in distribution of climate change consequences. And this is, you can see that these cities, Dublin, Helsinki, Riga, Vilnius, and Zagreb, can be more prompt on flooding, on heat waves, the south, but also north. You can see Stockholm, for example, in coming years, and droughts is the last. So this is the worst projection, and which increase the all hazard for most European cities due to climate change. Of course, as I said, the infection diseases are part of the big picture. We have the examples of vector-borne diseases in our region. We have some mosquito species like Aedes aegypti, which is re-emerging, and Aedes albopicus, which is emerging in our region. And of course, mosquito-borne and tick-borne, all connected with the influence of climate change. And the projection is that the climate change will facilitate the spread of the West Nile virus in Europe. And you see on the right map, and also the climate change is increased the risk of chikungunya transmission in Europe. This is the projected change in the climatic sustainability for chikungunya transmission in the European countries. So, in nutshell, the major increase of ill health in European region will occur through the expected further impacts of extreme weather events on health, disruption and stressful and changing distribution on infectious diseases, changes in air quality, food and water quality and security. And please take these messages I would like to highlight the importance that health is sensitive to shift weather patterns. Climate change is already adding to the burden of diseases and illness. In Europe too, the most vulnerable and those whose health is most affected by the present-day climate, and the largest risk are extreme weather events and infectious diseases in European context. So this was maybe my first part of the discussion of the presentation about the climate change itself, and now I will be more focused on the needs of estimation, the health damage, but also to estimate the adaptation cost. Because you probably heard about the United Nations Framework of Convention on Climate Change, or UNFCCC as we call, which set an overall framework for intergenerational efforts to tackle the challenge posed by climate change. And under this process, under the UNFCCC, the Paris Climate Agreement on climate change is the first universal, legally binding global deal to combat climate change and adapt to its effects. So there are two major ways how we can tackle the climate change. The mitigation, which is action take to cut the emission of greenhouse gas emission, because it generally refers to implementing action aimed to reduce this emission and to preserve and enhance the sinks and reservoirs of greenhouse gas emission. And then to help the adaptation, which is the process of adjustment to actual or expected climate and its effects in order to modify moderate harm or explore beneficial opportunities in human system. For us, this Paris Agreement is also public health agreement, because by tackling the climate change, we will save the human lives. And definitely we will have a possibility to use efforts to put in something else than in this system. Also, it's important that WHO develop a systematic approach to health adaptation. Since 2015, where we publish our guideline of health vulnerability impact assessment on climate change and health. Now, just recently, we published about our operating framework for building climate resilient health system, which objective is to provide guidelines to health system and public health program to increase their capacity for protecting health and unstable and changing climate, and by implementing the 10 key components laid out in this framework, the health system will be able to anticipate, prevent, prepare for, and manage climate-related health risk. Of course, the health, the climate change has a wide range of implications for human health, including increased mortality and morbidity, like we see from extreme temperature and other extreme weather events, or infectious diseases and diseases resulting from air pollution. Aside from the pain and suffering caused, of course, this illness result in premature mortality, additional use of healthcare, and loss production, thus burdening individuals and society with additional partially avoidable loss of welfare, which can be translated into economic cost. So these health costs are the sum of the healthcare costs, of productivity costs, and premature mortality costs. So this system, there are a lot of approaches which is present these days. Sorry? Okay. However, the health expenditure rapidly increase in many countries, and healthcare needs are often not met, and this in particular in low and middle income countries. So you can see that the expenditure on prevention and public health account only 3.6% of total health expenditure worldwide in 2013. So prevention and public health service should be equal to adaptation on climate change. So we need to increase our prevention in order to decrease the total expenditure on health. Does our office support European countries based on the mandate we got from the resolution of the policy, from the Ostrava Declaration, about the awareness raising and education on building institutional and workforce capacity, on public health approach to adaptation and mitigation, on mainstreaming health in other policy, and thus we develop several tools to support our member states. One is on mitigation, which will be published very soon in coming weeks, about the carbon reduction benefit, co-benefits on health due to estimation of Paris Climate Agreement pledges by the member states, because the member states pledge they will cut the greenhouse gas emission, and we did the estimation by country for the whole EU European region member states what means to from avert mortality, and in economic costs what will be the savings, the co-benefits if they implement their intended national contribution. And the second one is on climate change and health adaptation, for which I will speak more in details now. But it's very important to discuss why assessing the health economics of climate change and adaptation is important, because it should follow the same principle as other public policies like accountability, transparency based on evidence, then the economic dimension of the problem, because it is not often realized, then doing nothing entails large economic costs that should be revealed to enable a rational decision, and it makes a good business sense as case for action can be strengthened with economic data. So when we talk with economists, they are not very much interested about our mobility and mortality and morbidity dates. They have to see some more economics data on the issues. So it's very important to be aware that decision makers are not public health professionals, and they or policymakers need also to know, of course, the cost of inaction or doing nothing in terms of economic consequences. We saw in the previous slide our projection for deaths in the coming years with best scenario, with the worst scenario if we do nothing, but then the cost of action, the implementing adaptation, which include measures in the health sector and also those taken in other sectors to protect health, and the residual costs, as adaptation measure may not avert all climate-related health impacts, because this is also a very sensitive thing, and it should also based on some evidence. So thus we were very happy, in fact, to prepare the economic analysis tool as support for additional planning, because this tool consists of a manual on your left side, which should describe the steps and input required, and the methods, data and analysis for filling the data sheet, and the Excel spreadsheet, which compares 5 worksheets, 3 for data input and 2 for output, which include integrated formulas to facilitate the calculation. Of course, there are no black boxes. All formulas are open via WHO. Also, specifically, it will assist in estimating of cost of health damage due to climate change at national, at subnational level, at local level. It very depends how it can be used. Estimating the cost of health-relevant adaptation to climate change at national and subnational and local level, and comparing the cost of health damage averted with the cost of adaptation measures in order to reach conclusion on value for money. So this is our tool, and I will try to, in nutshell, to inform you with our example. For example, we will take one country of this exercise for this webinar, which is prone to hot spells, which are projected to increase in frequency and intensity with climate change. Heat will increase mortality and morbidity, especially for cardiovascular and respiratory causes. And based on the same previous modeling, the Ministry of Health has determined the projected mortality and morbidity attributable to heat waves in the next 5 years, for example. And they have also ascertained in the fraction that is due to climate change. So this is our example. We will do this figure illustrates the methodology steps in a full analysis, and the steps in the red square are to be undertaken either before the economic assessment in fact, the health damage, or additionally of the effectiveness of adaptation. Several types of technical knowledge, of course, are needed to use the tool, including some economic knowledge, some epidemiology, public health, and health information. So it's good to have a team of people who work on this area and to work together in order to achieve the project intervention you intend to submit to your decision makers. So the user should be prepared to seek some information also from several agencies or ministers of institutions and from public health and healthcare institutions as well. And this is the Excel-based calculation methodology was devised based on common economic methods for estimating the cost of illness. And the premature deaths were valid using the value of statistical life. This is the special, I will not go in details, but this is one of the chosen methodologies, which is also these days one of the gold standards. Productivity using the average daily GDP per capita multiplying by the average name or days of healthcare. So in fact, as I said, you can start with total climate change attribution, case per year mortality due to this, and then to put all these economics to define the cost of illness, in fact. So, and the results from this study show that this is the distribution of the respiratory by the years, the number of cases and the total, and how of them are attributable to the climate change and heat in particular. So you can see that just few of them, less than several percent, are attributable to the heat, but it's important that in the coming year, this percent will be increased due to climate change. And this is the health cost of the estimation, the damage cost, in fact, because to estimate the cost of damage to health, the mortality and the number of cases in the study area per year are required, as well as those attributable to climate change and other information. Disability adjusted life years. Our example for damage cost 5 years of retrospective analysis was included, and in this particular case, due to high value of life compared to treatment cost, the of 99% of total cost, and of course then the national annual cost as per GDP. Of course, it's important to preventing the health effects of heat waves requires using the adaptation cost sheet in the Excel is the calculation cost of adaptation to avoid health impact. And here I listed all in variety of ways. And here is the summary of left side figure. You can give an example of the annual cost local currency units. Because they will be different in every country. In this example, the main one is investment infrastructure and lesser investment by the local government from the right figure. This costs include the energy efficiency measure, air conditioning and water, fountains in hospital and nursing homes, and communication and awareness raising for medical staff and the general public. The investment costs such as infrastructure, equipment, and training are important for effective health preparedness and response. Of course, then when we have from one side the health cost, when we have then adaptation cost, now we're going to the output sheet to estimate the benefits of adaptation or avoid health impacts and averted costs. We need to translate avoided mortality and morbidity into economic benefits, and we have the calculation, and then we have the result that the damage and adaptation costs can be compared at the end of costing exercise. In this example, it is possible to compare the damage cost of its increase in these cases and that was not averted with the cost of adaptation, as is expected. A partial reduction in the health impact due to the new adaptation measures which were established. So in the adaptation cost is estimated at 3 million local units or 240 euros per year for the coming, and the total damage cost of the estimation of the mortality and morbidity is 2.7 million. That means that if this be seen as a cost-benefit analysis, that for the one, and we can of course not avert all deaths, but the majority of them. So when we compare with the total damage costs, it's around 2.7 million. The adaptation costs appear to be relatively small. So it's worth to invest in adaptation in order to definitely avoid mortality and morbidity due to some hazard, in our case due to heat. Of course, when we talk about such type of analysis, we always have to acknowledge the uncertainty in the proportion of diseases caused and death attributable to climate change and how many could be averted by the adaptation measure. Even this is difficult to make. The fully cost-benefit comparison for the decision makers will be important to see that putting adaptation does not mean investment, does mean the opportunity for good investment to avoid the mortality for the people. Of course, from one side, the cost that met from the existing budget and additional resources for this action plan were including in this case, and probably will, this adaptation cost can be increased with in the future with involvement of the cities, municipalities, of other agencies, but definitely will be beneficial when we compare the adaptation costs with the damage cost. So in a nutshell, this was the example I would like to share with you. It is important to be aware that the health impacts of climate change entail serious economic consequences in terms of premature mortality, healthcare costs, and lost productivity. Unfortunately, most of these casualties are invisible people because it's very difficult to estimate the proportion of the people who died from the heat, for example. That's why we use attribution and we project them, which is in our public health, this is very common approach. We see that it is possible to calculate the cost for adaptation planning purposes and to inform our decision and policy makers, because the health adaptation measure for most climate-related health impacts are frequently well known. So in our case, the adaptation, as I said, is equal to the health prevention, which is a basic measure for the public health. And the local authority can be engaged in health adaptation actions as well, to be a win-win situation, because the estimation of costs and benefits of adaptation can definitely support the process. With this, I will end my presentation. I'm very looking forward for your question. I have only to inform you that the toolkit manual is available online of our website, euro.who.int, under the climate change. Under the publication, you can find our toolkit manual. And about the Excel spreadsheet, please write to us in euroclimate.who.int and tell us a bit about your organization profile and intended application of the tool, and we will send you immediately afterwards the tool for you, because we would like to have information who is our main users. And that's why it's on request. It's, of course, free of charge. Thank you.
This is really a very much comprehensive presentation also on the climate change issue at the beginning. That was extremely interesting, and I'm sure that everyone would like to receive the presentation, and we will share the presentation with our audience. I see it was also, I mean, there are many slides which were very interesting. Also, the cities in EU most affected by the extreme weather events was very interesting, also by what kind of events, like flooding, heat waves, or drought. That's very interesting. And also we are here in Venice, in the Veneto region, which is one of the very much affected regions by the West Nile fever at the moment, and it's really worrying to see the projections by the year 2050 when it comes to the West Nile fever. And these are just a couple of slides which really caught my attention. And also thanks for highlighting the inequity dimension of this issue, which is very important. And also, of course, for highlighting that this is really a costly issue, and the cost of inactions are actions. Can you hear me, Vladimir? Yes?
Yes.
And I would like now to ask participants whether they have questions about the presentations and also about the tool. If you have questions, if you can write it down in the chat, that would be very useful, and then we will read it to Vladimir. And please send the questions to everyone in the chat so that I can see that. I have a question on the Excel spreadsheet that you showed in one of the slides, the one with all the numbers titled damaged costs. And I was wondering, so you said that it's necessary to have quite a broad number of expertise for using the tool to some extent, because the data which needs to be filled in are quite many and of different extent. Can you tell us something more about how to populate this table? What kind of data are necessary? And also I see here that there are different, the same mortality, morbidity data. They are for different years. So this is, of course, a requirement for getting accurate estimates, or are there like a way around it? Because I guess these might not be so easy to get, especially if you want to use this tool at the subnational level, where these figures might not be available. And while you answer this question, I ask again to other participants whether they have questions to direct them to me, and then we will go to Vladimir. Thanks.
Thank you, Francesco. Very important questions, because I lead, in fact, the team in my country where we did the pilot of this tool several years ago. We really struggle with some of the information, but definitely you will need some efforts, but it's worth, because all of these data are available. It is on the yearly base, so this is the total number of, for example, because it was, we need first to justify, to define the vulnerability. That means that we define the group of the people who are most affected, and this is the elderly of the heat. People, for example, more than 65 years, both men and females, and we focus on circulatory, on cardiovascular diseases. So we need the number of total people on morbidity or who die from this particular year, and then to estimate the attribution. As I said, there are many information available about the attribution of heat. Even we can estimate with some uncertainty some at the country level. We can extrapolate to the local level. For example, in Italy, you have a lot of city level attribution to heat. For example, in many cities. So if in neighborhood, your neighborhood, there are no information, you can use the one from your neighboring city. If you have the similar climate, and adjust with uncertainty of this, and then you will need also to have a team, at least one public health specialist, one epidemiologist or statistician, and then some health economists. So this is something which can be found in each of the cities, and I'm fully aware that it is possible. It will need a lot of teleconference with your health department, with the people in the statistical office, and but definitely all of these data are available. This was done, for example, for Macedonia. When it is in Macedonia, definitely in other country, it is also available.
Okay, thank you very much. And I understand also that you would be available for these many teleconferences which might be needed for clarification, or someone from the Bonn office, in case anyone of the participants is interested in running this tool concretely. We have one question. Is this tool especially designed for the EU region, or could it be used for countries in other regions?
Of course, it is. We have a lot of, as I said, that's why we need to see the request for this tool, where it's come from. And we have a lot of requests from South America, from Africa. So it can be used everywhere. As I said, we have no black boxes. All formulas are there. You can find in manual the definition of each of the definition. What means health costs, how it's calculated, and it is one tool for cost-benefit analysis. You can even use not for adaptation. You can use even for air pollution of any public health measure which have some intervention to measure the intervention cost, then to measure the damage cost by some risk or hazard, and then you can have the outcome as a cost-benefit. So mostly it's used by academia, but also the local authorities also use this tool.
Thank you, Vladimir. And another question is about the possible future plans to have this tool translated in other languages? Is it available also in other languages, or is it only in English?
It is only in English, fortunately. So if any interest, big express interest by some other speaking country, they can request, and we can give our permission to be translated without any problem, but following our WHO rules.
Okay, that's also quite an important message in case there is any country which is strongly interested in having it translated and wants to take the lead. This is indeed possible according to the rules that we have for our documents in WHO. I think that was there any other comment? Maybe Christina wanted to make a comment about something from the New York Times, about something that you were saying before.
Yeah. Good morning, everyone. Do you hear me? Yes? Okay. I would just add, thank you for the interesting presentation, Vladimir. And I will just add that in the New York Times, some weeks ago, it's about 2 weeks ago, published an interesting tool that included the number of days every year with an average temperature over than 32 degrees for each city of the world. Today, when you were born, I mean, starting 1950, circa, and so when you was born now, and when you will be 80 years old. So, for example, I have a plan for 2068, for example. So it's so far from here, but it's so interesting. For example, in Venice, I calculated, in Venice, in 1963, I choose a possible year, Venice has just one day during the year, about 32 degrees Celsius. In today, the days are 10, and in 2053, so about 80 years later, 20. So double from today. So I think it's so interesting if you could check your city, and so it's interesting. And you also see which kind of areas in the world are most affected by, I mean, high temperatures or whatever. So it's just a suggestion for you to go deep.
Thank you. Yeah, that's also an interesting thing that a journal like the New York Times picked up this issue also in a way which can be communicated easily, like a number of days above a certain temperature, which is easy to relate. And I guess everyone wonders, okay, when I'm 50, when I'm 70, how many days will I suffer with more than 32 degrees? I guess that this is also quite interesting, and this is similar also to a slide that you also showed, Vladimir, like in terms of like the number of days above certain temperature, right? It was one of the things that you also mentioned.
Yes, indeed. As I said, there are no good news for the future. There are a lot of estimation. It's very dependent by us. Because we know the problem now, we know also the solution, but it's very, very depend to this generation how we will act now and on implementation of the Paris Agreement, because this is the way of its implementation, how he can produce better world not only for us as generation, but also for our children and their children as well.
Yes, thank you very much. This is indeed a call for action and to act now. Yes, definitely now we know many more things than in the past, and there are no more excuses, I mean, from all points of view, and it's also a very costly issue. If there are no other questions, then I would just like to remind all of you that the next webinar will be on urban green and blue spaces, and it will be on the 5th of November. And then we will have our last webinar of this series in December on health impact assessment. Between the two webinars, there will be, at the end of November, a workshop during the UFA conference in Ljubljana, This workshop will be on the 30th of November, and it will be on air pollution, which was also one of the topic of our previous webinars, and active mobility. So for those of you, and I guess there will be many, who will be attending the UFA conference in Ljubljana, please don't miss this workshop on air pollution and active mobility. Having said that, I would like to thank once more Vladimir for his competence, for his knowledge, for sharing his wisdom with us, and also for urging us all to take actions now. We apologize for the slight noise keyboard that we could hear. It means that maybe someone took very many notes of this meeting, which is of course very good. Thank you once again for having spent these 60 minutes with us, and thank you again, Vladimir and all who made this webinar possible. Okay, enjoy the rest of the day. Thank you very much. Bye.
For invitation. Congratulations, Vladimir. Very nice presentation. Very interesting presentation. Thank you again. Thank you again, Francesco, for invitation.